COVID-19 in Accra.
Between the 18th and 19th of May, a total of 173 new cases has been recorded in Ghana. 46 of these cases have come from Greater Accra, 6 from Eastern Region. Central has recorded 27 new cases. Western Region also increased by 59 cases, and followed by Ashanti with 35 new cases. At the same period, we also recorded an additional 144 recoveries since the last update. And so the total count for recoveries now stands at 1,898, bringing our recovery rate to about 30.2%. But I must let you know that we have a large pool of people waiting for a second test, and I believe that in the next few days, the new numbers will be added.
Information Minister Mr. Kojo Oppong-Nkrumah has debunked claims that the country has received herbal medicines from Madagascar, which is meant to cure COVID-19. Mr. Oppong-Nkrumah says the government will continue to liaise with the appropriate agencies before the mixture is approved.
Earlier this week, there have been two, may I say, misreports that have gone deep in the media, and we need to correct it. One is that government says that it has requested for the Madagascar cure, and there are even other reports that say we have received it and we are testing. I just want to be clear on that one. What we have said is that Madagascar has reached out to us with their supposed or their suggested cure, and that we will test it through FDA and Center for Plant Medicine before making a decision. The brief as I have it is that we have not received this supposed cure from Madagascar. There are also local offers, local Ghanaians who say they have some sort of preparations that they believe can cure. The Center for Plant Medicine and the FDA stand by to test whatever of these supposed cures are available. And after those tests have been done, a decision can be made by the clinicians. So I just want to be clear, the reports that Ghana has requested for, or that we have received and we are testing from Madagascar, is incorrect. What we have said is that they have reached out to us, as they have done to many other countries, that they have something that they believe can cure. What we will do is that we will test it when it is made available to us. We have said that if indeed they have a cure, no challenge, they should let us have it and we will test it and see. At the same time, there are many other local persons who say they have a cure. The same time regime, FDA and Center for Plant Medicine will test it and make a determination. So please, let's be clear, we have not requested for it, neither have we received any. So just to clear up that reportage.
Meanwhile, Information Minister Mr. Oppong-Nkrumah says schools in the country still remain closed until all consultations with major players in the sector agree on a common date for reopening.
We have observed from Media Monitoring Center lots of reports that say that government says that schools are to reopen soon. With the greatest of respect, it is not correct. Government is not saying that schools are to reopen soon. What we are saying is that consultations on what it takes to reopen schools is what we are currently engaged in. If there's been a misspeak or something of the sort, just to put it in its right context, consultations on what it takes to reopen schools as part of the potential easing of the general restrictions that we are living under are what have started. Now, we notice that there are a lot of stakeholder groups and parents and unions that appear a bit apprehensive since those reports came out. It is okay to be apprehensive. Indeed, if we were not apprehensive, then we will not be sensitive to the challenges of the time. It's okay to be apprehensive. It is okay to have worries. It is okay to wonder how this will be done. But we must channel those apprehensions and those worries towards answering the question, what does it take? What should be the indication of a good time? What will be the best way to protect teachers, non-teachers, students, if we are to open up at some point.
We're taking you now to Ashanti. So far, 30 health workers in the region have tested positive for COVID-19. However, all the affected persons comprising various categories of frontline workers managing the pandemic in the region are in stable condition and responding to treatment. The Ashanti Regional Health Director, Dr. Emmanuel Tinkrang, disclosed this at a news conference in Kumasi.
The Ashanti Regional Health Directorate was given a regional update on COVID-19 at a media briefing. The Regional Health Director, Dr. Emmanuel Tinkrang, said the situation would not in any way affect the wavering result of health workers in the region to contain the disease. He said the case in the region was beginning to reduce. Cases in Obuasi, which has been the epicenter, accounting for about 65% of the 886 confirmed cases in the region, have reduced. Dr. Tinkrang further disclosed that the Obuasi municipality and Obuasi East District have recorded 587 confirmed cases combined out of about 6,000 samples tested.
We hear some people saying that, oh, if you believe that the disease is there, show us some of the people who are sick. We have standards and protocols as far as the medical front is concerned. We don't disclose identity of people who are sick or people who are afflicted by disease. So it's not right, it's unethical for anybody to say that we should expose those people who are sick or those who are dead for people to know that the disease is really there. If the person willingly feels that he wants to support the program by coming out to say that he wants to help by disclosing his status and other things, that is acceptable. But that is left to the individual to decide.
The Regional Health Director explains that the huge number of cases recorded in the Obuasi area on May 8th was as a result of a backlog of samples taken from April 19th to 27th, following the confirmation of a case in one of the Obuasi markets. According to him, the patient who later died had spent about 2 weeks in the market without knowing her status and ending up spreading the disease to a lot of people.
One major challenge that we have right now and that we want all of you to help to address is that of fear, stigma and discrimination as far as people of Obuasi is concerned. As I keep on saying, if that's the way we will drive the agenda of COVID-19, with stigma, fear and discrimination, we will not achieve any results. We had opportunity to talk to some members of the community and even those who are operating in other towns, that anytime they go around and they say they are from Obuasi, then it becomes another issue. People don't want to sell to them and other things. So all of us should understand that we are fighting COVID-19. We are not fighting people. We are not fighting Ghanaians. It's through no fault of theirs that they have the infection.
Dr. Tinkrang said his outfit had intensified surveillance and deployed more health workers to the area. Giving a general overview of the situation in the region, he said 15 people were on admission, 75 in isolation, while contacts of 54 were being traced. He said 25 out of the 43 districts in the region had reported confirmed cases. 52% of such cases were female, 48% were males.
Still in Ashanti. Not many people in the Kumasi metropolis are wearing face masks as directed by the health authorities, even though some in the informal sector are aware of the importance of wearing masks. They say they do not see the need to wear it at all times except for when they are in public places. However, in the business district at Idum and at the banks, majority of customers are complying with the directive. In this report from Kumasi, our news team says security officers are on the streets trying to educate the public on this important measure to stay safe.
Our news team established on its rounds in the city that the awareness level of the need to wear the masks is high. In some offices, workers were adhering to the directive of hand washing and social distancing. In other locations, it was observed that the Veronica buckets were strategically placed. Some had water, soap, tissue and sanitizers, while others either had the buckets with no water or soap. Some had masks and failed to wear them, describing it as an inconvenience because they could not breathe properly. There were vigorous checks on passengers on vehicles and also at the ATMs at various banks with the inscription, "No face masks, no entry." The digital infrared thermometer was also being used, all